February of 1942, and a wounded soldier lay feverish on his cot amongst his fallen comrades. He is in pain and jumping at the sounds of gunfire still ringing clearly in the morning as World War II continues without him. He is afraid, convinced he's going to die from the infection from the bullet wound in his shoulder. Constant reminder that he won't go out in a blaze of glory, but slowly, with the black sickness draining his strength. But he doesn't die. The doctor prescribes him a course of penicillin, and as the days pass he heals and returns to duty. Later, he watches as countless other men are prescribed this miracle drug. Half will still die. He wonders why the cure did not work as it did for him, and if his recovery really was a chance. We have all had that moment in our lives where we feel terrible and don't want to get out of bed, but go to the hospital because we have to. We sit and wait for hours just for the doctor to spend 5 or 15 minutes with us to hand us a prescription for antibiotics. As it turns out, this happens more than just a few times. According to Martin Blasser, a doctor at New York University's Medical Center, who spoke with a representative at WebMD, the average person takes 10 to 20 courses of antibiotics before they reach age 18. The problem is, if the illness isn't bacterial, the antibiotics won't work and contribute to the growing strain of antibiotic-resistant diseases. A 2011 survey conducted by the IDSA and located on the PubMed website discovered that greater than 60% of those surveyed had resistant bacterial infections within the last year. As Sir Alexander Fleming warned in 1945, public will demand the drug, then begin an era of abuses. And he was right. The FDA has stated on their website that as of 2011, they have begun efforts to address the antibiotic resistance epidemic occurring across the U.S. Antibiotics are revolutionary when used correctly, but when not, a healthcare crisis develops. The world of disease is complex, but antibiotics are not cure-alls. They can only treat specific illnesses. So let's look at what they can and cannot cure. Antibiotics only treat things caused by bacteria, as stated by the FDA. Kaiser Permanente lists a couple of these illnesses: strep throat, some sinus infections, pneumonia, some ear infections, urinary tract infections. However, doctors are prescribing antibiotics as treatments for other things like viruses. As WebMD states, coughs, bronchitis, some ear infections, colds, and the flu cannot be cured by antibiotics. So, what happens when a non-bacterial illness is treated with an antibiotic? Antibiotics that are used incorrectly, as described by the CDC, gives the bacteria an attempt to resist the drug's effects to kill it and stop its spread through the body. And according to the Journal of Managed Care and Hospital Formulae found on the NIH website, it's attributed to the overuse and misuse of these medications. The Infection Control and Hospital Epidemiology described that half of the doctors they studied kept their patients on antibiotics even after test results indicated viruses. It's not only the doctors contributing to this rising threat. The public misuses or incorrectly administers their own. Following incorrect procedures for prescriptions leads to resistance, and the FDA has found a list of things people do incorrectly. Not completing the full course of antibiotics because they feel better, skipping dosages because of side effects or because they forget, and saving antibiotics for the future all lead to some form of resistance. So why is it a problem to be resistant? Some resistant bacteria mutate and cause deadly diseases, and we aren't prepared to deal with them. There's a lack of research for new antibiotics, meaning there's no standard treatment when a resistance occurs. In 2006, the NIH found 2 forms of infection, sepsis and pneumonia, caused nearly 50,000 American deaths. Of the 18 largest pharmaceutical companies that used to study it, 15 have abandoned the field because regulations have changed for new antibiotics. Clinical trials have to be adapted because the FDA has considered placebos unethical. And the changing requires of increased costs, and nobody wants to conduct trials when it costs more money. Antibiotic resistance is a growing epidemic because of misuse of antibiotics. Infectious bacteria develop resistance and evolve into untreatable illnesses. The lack of research and changes in regulations have stopped any form of solution. I previously stated that some of the resistance problems come from improper handling of their own personal prescriptions, so I hope that you will follow doctor and medical instructions the next time you take a course of antibiotics. H.G. Wells once said, "The path of least resistance is the path of the loser," but in this case, we are all winners with a little less resistance. Thank you.